Hardly a year since COVID-19 caused the worst health shock of our lifetime, scientists made sure to be quick on their feet to produce suitable vaccines that many hoped would bring some sort of stability to the shaky economic situations around the world. While much of that hope is still alive, the evolution of the coronavirus into newer and apparently more contagious, deadlier strains has raised concern about whether or not these available vaccines will work against these strains. As more people are being vaccinated, including here in Botswana, where more than 30,000 people have had their first shots, people still question if these vaccines available locally offer adequate protection against the newer Brazilian, UK, and especially the South African COVID-19 variants. The words that keep coming up in these conversations are efficacy and efficiency. But exactly what do these terms mean in this instance, and what do we need to understand about these new COVID-19 strains as regards these new vaccines? As ever, consultant cardiologist and pharmacologist Dr. Kiran Bhagat is on the line with the answers.
To date, almost 900 million people around the planet have been vaccinated against the COVID-19 virus. However, there are increasing variants, I call them scariants, which are causing concern amongst the public about the effectiveness and efficacy of a vaccine that we are going to be using in Botswana and perhaps the rest of the world. Clarity needs to be given to the public, who often are failing to understand what effectiveness and efficacy actually mean when it comes to vaccination. At present, it is true to say that all vaccines that are currently available do work against the original ancestral COVID virus, as well as its variants, both the Brazilian, the British, and the South African variants. The effectiveness, however, may reduce slightly against the South African variant, which we are now facing in Botswana. But even the vaccine that is currently being given, called Covishield, or the AstraZeneca vaccine, does have an effectiveness against severe COVID infections and may even reduce moderate infections from COVID. However, if we tackle all the vaccines together, it is important to remember that vaccination is the only way forward to prevent serious hospital admissions from COVID, and vaccinations will reduce this incidence and increase the herd immunity. You may well need a booster shot after 8 to 10 months as the immunity wanes, but it is important to remember that these variants will continue to occur as the virus is only beginning to learn its way through the human system, as it is new to the human body and is trying to adapt to accommodate to the changes within the human system. So equally, what is important is to remember that what we are trying to prevent by and large is death or hospital admission with severe COVID infections during the COVID epidemic. If you suffer from mild to moderate symptoms, it may be like having a nasty flu, but you will not need to be admitted or cause a strain on the hospital system. This is as important as being sure that you have been vaccinated by the vaccines that are currently going to be distributed in our country.
In Africa, help is what we do. That is why we at FNB are relentlessly driven to provide real help to you, the passionate and courageous, the creators and the optimists. These are the entrepreneurs we support, the communities we uplift. It is because of you that real help is what we do. FNB, how can we help you?
This program was brought to you in association with First National Bank of Botswana.
FNB, how can we help you?